Here we are at the first ever Cell Coast conference that Moffitt is sponsoring for looking at CAR T cells and bispecific antibodies and other therapies that leverage cells to treat cancer. And so I'm here with Dr. Julio Chavez, who is an expert in lymphoma and the treatment of patients with CAR T cells. And Dr. Chavez, I would like to ask you, what to you is the most interesting advance from a clinical trial perspective in lymphoma over the last couple of years?
To me, thank you again for having me in this conference. It's very exciting. Our first conference here in Tampa. To me, the most important advance is that the widespread use of CAR T among different subtypes of lymphoma. We have CAR T approval for aggressive lymphomas, for follicular lymphomas, mantle cell lymphomas, other indolent lymphomas, even though they don't have the specific label, but we're using it because of the clinical data that is available. So that's probably for me the most important. The second most important aspect is we have a substantial real-world experience that was led by you that informs the community the efficacy of CAR T cell therapy is translated from the clinical trial towards the real life.
Great, so that's really great. And I have a question, what makes a good patient for CAR T cell therapy? What are the characteristics of those patients?
I think for me, in my clinical practice, the best patient is the patient who's informed. The patient needs to know what CAR T implicates, like the logistics, the traveling, the ability to have a caregiver, the knowledge of the side effects of CAR T. Many times I find patients declining because concerns, sometimes I would say a little misinformation that came from other centers about CAR T safety and toxicities. And so I think that's probably the most important patient, informed. There are patients that have comorbidities, that are older age, they have other issues that may affect CAR T eligibility. But as long as the patient is informed, we have vast experience with CAR T, we can treat majority of patients, I would say. Very few patients are actually ineligible for CAR T based on clinical conditions. We have significant clinical experience or clinical retrospective studies data that show that even patients who were not eligible for CAR T in the pivotal studies, they were able to be treated in real life and they have a very good outcomes. I think most important is the patient who's informed.
Great. Well, thank you very much for this opportunity and looking forward to all the great work that you'll be doing in the years coming forward.
Thank you for having me.